Hi, my name's Dr. Alison Freeland. I'm a psychiatrist here at the Royal Ottawa Mental Health Centre, and today I'm going to be speaking on mental health legislation in the emergency room setting. There's three main objectives for this talk today. The first is to recognize that there is legislation that influences the practice of medicine. Secondly, using a case to discuss the application of the Mental Health Act to practice of medicine, specifically in an emergency room setting. And the third is to explain the concepts related to the Healthcare Consent Act, including informed consent and capacity to consent to treatment. So I'm going to start with a case study, and I think this is a case that would be very familiar to those of you who work in the emergency room setting. So the case is a 22-year-old young woman who's a university student who's brought by police to the emergency. On arrival at the emergency, she smells of alcohol and appears intoxicated. She's quite belligerent, swearing, and during the course of triage has taken a swing at the ER triage nurse. She's quite uncooperative with examination, so really all the history that you can obtain is through the police report. And what they say is that her boyfriend called 911 after she began screaming at him, threatening to jump off the balcony of her third-floor apartment to kill herself when he told her that evening that he was ending the relationship. You also have the hospital records available, and they reveal, in terms of psychiatric history, a major depressive episode a few years earlier. And this, her presentation was precipitated by a suicide attempt by overdose, which she subsequently required a short stay in ICU, followed by a transfer for 1 month of inpatient treatment on a psychiatric unit. Unfortunately, you're unable to reach her boyfriend or family for any further history, and because of the patient's uncontrollable behavior and the police report of threat of self-harm, you determine she requires further assessment. So the question at this point then is, what do you do now with a very uncooperative patient that you're unable to get clear history from? And as we all know, this is where we would need to turn to mental health legislation for direction about how to confine somebody in a hospital-based setting for further evaluation. In Canada, each of our provinces has very specific legislation that describes principles of an individual's rights and how we have to balance these against protection of both the individual and of society when somebody is presenting with severe manifestations of mental illness. And all of us as physicians and healthcare providers have a duty really to be aware of this legislation and how to implement it. In Ontario, we have a Mental Health Act, which was first brought about in 1990 and then has gone through a couple of revisions, with the most recent revision in 2000, which followed Bryan's Law, which invokes some changes around how to put somebody on a community treatment order, and also talked a little bit about issues of application of Form 1s. Our Mental Health Act in Ontario really focuses predominantly on the business of involuntary psychiatric assessment of a person, and as well speaks to the issue of involuntary admission and discharge from facilities. Just a reminder that we actually have 4 different acts that govern how we deal with people with mental illness in Ontario. As mentioned, there is the Mental Health Act, but in addition, the Healthcare Consent Act, which I'll touch on a little bit today, speaks to the issue of informed consent and capacity to consent to treatment and a few other things. There's also the Substitute Decisions Act and the Personal Health Information Protection Act that also touch on how we interface with people with mental illness who are unable to make clear decisions about themselves, their property, and their care, and also describes how we manage their medical records. So in the case that we just discussed, essentially this young woman, when she was brought to the emergency room, she would have been brought on, under the Mental Health Act on Section 17, which I'm sure people who work in the emergency room are very familiar with. So Section 17 of the Mental Health Act basically is a person who's brought to the emergency on authority of the police. And this is where a police officer has reasonable and probable grounds to believe that a person is acting or has acted in a disorderly manner and has reasonable cause to believe that there's a risk of harm to self or others or imminent serious physical impairment. What's important to be aware of under Section 17, and this is one of the changes that came through in the Mental Health Act in 2000, is that prior to 2000, the police had to actually observe the alleged behavior themselves. The changes in 2000 mean that personal observation of the alleged behavior of the person by the police officer is no longer required. They can take information about the person's behavior, and even if the person is now settled down, if the police have reasonable cause to believe that it would be dangerous to wait to proceed to get a Form 2 or a Form 1, they can apprehend that person and bring them to a hospital for psychiatric assessment. So in the case study that we're working through in this situation, this would be a very clear example where the police would both have obtained information from another person and as well have observed behavior that they would have felt required apprehension under Section 17 of the Mental Health Act. Now, if the police had felt that there was not enough evidence to suggest that they could apprehend that person immediately, they themselves or the boyfriend could have gone to the Justice of the Peace and under Section 16 of the Mental Health Act would have been able to obtain a Form 2. Now, a Form 2 is a very important tool, and it's something that as clinicians we need to be able to advise the general public, family members, care providers about, because it certainly is a helpful way for people who are not seeing a physician regularly and who police feel unable to bring in themselves. It is a way for people to be brought in for assessment in an emergency room. Any person may go in front of a Justice of the Peace and under oath provide information around why they believe the individual should be brought in under a Form 2. The person presenting in front of the Justice of the Peace must produce evidence that allows the Justice of the Peace to see that the same criteria as you would see on a Form 1 is met in the description of what their concerns are. Once a Justice of the Peace approves a Form 2, the Form 2 then directs police specifically to bring the patient to a healthcare facility. A few more details that need to be clear around a Form 2 is that the Form 2 remains valid for 7 days from and including the day it was signed and dated. So it does allow the police a specific period of time to locate and bring that person to the hospital. And again of note is the fact that the Form 2 authorizes and directs specifically police officers to do this action. Ideally, the police officer would bring the person who is subject to a Form 2 to a hospital emergency room, preferably at a Schedule I psychiatric facility where there is ready access to a psychiatrist for ongoing assessment. But technically that person can be brought to any physician in any location for examination. Now the next piece of the Mental Health Act that is important, and again this is a tool that we're all very familiar with, but I think it's important to review what some of the specific requirements around a Form 1 are, just for the purposes of ensuring that legislation is accurately followed. So the next piece we'll discuss is the issue of a Form 1. And going back again to the case study, the Form 1 would be the next step to take with respect to this young lady presenting in the emergency room, because this is the way to contain legally this person for a period of time for assessment. So a Form 1 is completed by any physician who has examined the patient within the last 7 days, and it is valid for 7 days, just like the Form 2, from the date signed, which includes the day of signing. And what the Form 1 does, as we all know, is that it enables 72 hours of assessment, and a Form 1 is completed both on the physician's observations and by facts communicated by others. So when we have a look a little bit more closely at a Form 1, it's as I mentioned, it's important to really read the Mental Health Act to be clear that we're meeting the obligations spelled out in it. So the first part in a Form 1 speaks to the issue of examination for the purposes of putting somebody on a Form 1. And it actually says that the physician has to sign saying that they personally examined the person and made careful inquiry into all the facts necessary to form an opinion as to the nature and quality of the mental disorder of the person. So this is just to really reflect the understanding under the Mental Health Act that an examination does occur with documentation and evidence to suggest that there is evidence of a mental disorder, because there has to be that evidence in order for somebody to meet a criteria for a Form 1.